The difference between mankind and other species is our ingenuity. Throughout history, we've learned to invent and reinvent for the better. From the way we learn, transact, consume, care, and serve, adversity allows us to transform. Sure, industries will live and die. Life will change, but it beckons us to begin again, to live again. Just open your eyes and see.
Behind every healthcare provider, there are tests, scans, and data used in the care of COVID-19 patients. From the development of an antibody test intended to provide a clear view of a patient's disease progression, to a real-time PCR molecular assay to aid in the diagnosis of the infection from the virus that causes the COVID-19 disease, we're behind you. From CT scanners that help technologists maintain social distance, to ultrasound systems that may reduce transmission risk to others by not moving the patient, we're behind you. From staffing and training to education and real-time service, we're behind you. Because even in these unprecedented times, care is a partnership. And behind every healthcare professional, there are 53,000 Healthineers. Proudly supporting those who are supporting us all.
I'm RJ Balinbin, your moderator for today's session, where we will talk about digital care, health tech trends in 2021. This is the first part of Business World Insights two-part online forum series, focusing on the theme, the impact of technology on the healthcare sector. So more than a year into the pandemic, several hospitals in the Philippine capital have again declared full capacity for COVID-19 cases. And that, of course, entails a serious disruptions to our health services. In fact, almost every country, or 90%, according to the WHO, experienced disruption to its health services, with low and middle income countries reporting the greatest difficulties, as many of their services have been suspended. While critical care services like cancer screening or treatment and HIV therapy have seen very serious or high risk interruptions in low income countries. So today, we want to know how the Philippine healthcare system, including clinics and hospitals, can continue to provide services to all types of patients, not just COVID, through digital healthcare technologies like telemedicine, artificial intelligence, contact tracing applications, augmented and virtual reality, 3D printing, and so on. So, what are these things in the first place, and how do they help the Philippine healthcare system? Let's find out from our invited experts. Now, let me introduce our speakers. Our first speaker is currently the Director 4 at the Department of Health, Knowledge Management and Information Technology Service. He is a physician by profession and has held key positions at the DOH in the past 30 years of service. He has focused his career on public health, particularly in infectious diseases, epidemiology, health promotion, health systems, and universal health care, and has acted as OIC, Assistant Secretary of Health, in the same agency from 2010 to 2015. He continues to earn accolades for exemplary public service. Notable among them was the Gawad Career Service during the 50th year anniversary of his alma mater, the University of the East Ramon Magsaysay Memorial Medical Center, incorporated in 2007. Ladies and gentlemen, Dr. Enrique A. Tayag.
Hello, everyone. I'm Dr. Eric Tayag with the Knowledge Management Information Technology Service of the Department of Health. Today's pandemic has opened opportunities for all of us in the health sector, led by the Department of Health, to consider digital health interventions to address the gaps arising from the disruption, like access to service delivery, insufficient supply of commodities, the adherence to clinical guidelines despite the community quarantine, the lack of access for information, and specifically, how many Filipinos can access the health services that we provide. Together with the local government, we have introduced digital health interventions, and we hope that you stay and complete this program so that you can learn from us and you can help us as we work together to accomplish our mission to save more lives. Good morning.
Yes, good morning to Mr. Tayag. Now, our second speaker is representing Mr. Stavros Athanasiou, President of Medgate Philippines. He is currently the country manager for Medgate Philippines Incorporated, where he oversees all aspects of Medgate Philippines business, including sales, marketing, and operations. Prior to joining Medgate, he served as general manager for Assist America Asia, a world leader in emergency travel assistance services, covering over 40 million members worldwide. He forged long term partnerships within the insurance industry in the Philippines and throughout Southeast Asia during his 12-year stint at Assist America. Ladies and gentlemen, Mr. Ron Estrella.
Good morning, everybody. Director Tayag, Mr. Mike Tan, RJ, and to everyone watching, good morning. I wanted to apologize on behalf of our president, Mr. Stavros Athanasiou, that he could not make it as he has been ill since yesterday. He was certainly looking forward to this session. I am, however, delighted to join this session and share my thoughts on the impact of technology on the Philippine healthcare sector. First, I would like to introduce who we are. Medgate is a telemedicine company that provides medical teleconsultations over the phone. We were founded in Basel, Switzerland in 1998, and we have been delivering teleconsultations for over more than 20 years. Medgate has handled over 11 million teleconsultations worldwide, and our platform is robust and tried and tested for the delivery of high volume teleconsultations to a large member base. In the Philippines, we have been operational since 2016, bringing the best of Swiss technology to give the care that comforts to Filipinos. Currently, we cover over 1.5 million members. Our aim is to provide accessible healthcare to Filipinos. This means that even in areas with limited access to a doctor or healthcare facility, residents will be able to have a consultation without leaving their home and incurring commuting costs. We give people the peace of mind by providing a 24/7 telemedicine service that is reachable through various touch points, such as calling our hotline number through SMS, our website, Facebook Messenger, as well as our mobile application. Because of the pandemic, telemedicine has come to the forefront in people's minds as a viable way to get medical care without being exposed to communicable diseases. In our efforts to provide healthcare to Filipinos, we answer the call from the Department of Health and the National Privacy Commission to provide free teleconsultations during ECQ and MECQ to help in the fight against COVID-19. While we continuously strive to build awareness and trust in telemedicine in its current form, we also look to the future of advances in technology that may enhance the experience of our patients. On that note, I would like to share with everyone how we at Medgate are rethinking healthcare.
"20 years ago, we started as pioneers. We have set the standards for telemedicine and digital health. Right from the start, we have put patients first and provided first-class, easily accessible care. We have taken the doctor to where our patients need him, and we still do. Easy, efficient, compassionate. This is our goal, our driving force. This is why we exist. But we do not just want to be pioneers, we want to remain pioneers. We want our services to reach more people in more countries. We want to care for our patients not only in acute cases, but along the entire treatment pathway, from prevention and acute medical treatment to care for the chronically ill and rehabilitation. It's about making the patient journey more comfortable, safer, and more cost-effective, both today and tomorrow. To achieve this, we are rethinking healthcare, not just a little, but completely. Symptom checkers and artificial intelligence will be an even stronger part of our services in the future. We will use sensors, wearables, and AI-supported image and sound recognition. We will enable laboratory tests at home and offer mobile health services on the go. All of this will lead to improved access to care, more effective use of medical resources, and better outcomes. Our doctors will have more data and information and can use them for the benefit of their patients. They will be able to treat their patients even better and cover a wider spectrum. The boundaries of telemedicine are noticeably being pushed and, in many cases, even eliminated entirely. This is not utopia, it's the near future, and Medgate is determined to take advantage of the promising opportunities this future offers. Let's walk this path together. Let's rethink healthcare to give all patients easy access to first-class treatment. Let's rethink healthcare to bridge the gap between quality and cost efficiency. This is how we remain pioneers. This is how we keep defining the market and continue to set the standards. And above all, this is how we ensure the well-being of our patients. We are rethinking healthcare for patients and for society.
Thank you, Mr. Ron. Now, our third speaker is the President and Managing Director of Siemens Healthineers in the Philippines. He was previously the Senior Vice President and Country Lead for Siemens Incorporated Philippines healthcare sector before spinning off to its own separately managed company since August 2016. He has an extensive experience in the healthcare industry spanning for 40 years and is a well-respected leader in the field. He is instrumental in the growth of Siemens Healthineers in the country from a then small business unit to a now emerging entity with over 130 employees in headcount. He is also one of the founders and sitting board members of Healthcare Technology Association of the Philippines. Ladies and gentlemen, Mr. Juan Miguel Tan. Mr.
Good morning.
Go ahead.
Thank you for this invitation, and on behalf of Siemens Healthineers, we are very happy to participate and to spread the information we have. Digital healthcare has been around for decades in the Philippines, and with slow progress, but also the COVID-19 pandemic has accelerated this tremendously. And with the need for remote services, as well as the need for artificial intelligence, we our mission is to make things more efficient, make things easier, faster for both patient and the medical professionals. So with this, Siemens has been in the country for over 100 years. We sold our first X-rays in 1898 here in the Philippines, and we have stayed and are fully committed to this market and to the Filipino people in general. So we look forward to more the exchange of information that this forum will give us. Thank you.
Thank you, Mr. Tan. Now let's have all our speakers back on the screen for the Q&A. Hi everyone. All right, now let's proceed with our first question. Now I'd like to ask, I think Mr. Estrella can go first. What are some of the most important technology solutions today that have been helpful to the Filipino population since the start of the pandemic last year? Sir.
Okay, well, thank you, RJ. Of course, I'm going to be a little bit biased here. Clearly, telemedicine is where the industry I come from, and I do think we've made quite a bit of inroads, with the our Filipino customers. Certainly, the fact that teleconsultations, which is what we do, to deliver, a consultation 24/7 from anywhere at any time, I think is a great, force multiplier in a situation certainly where, simply put, we don't have enough frontliners and we don't have enough doctors. So for me, the ability to simply have a consultation without the geographic limitation that's typically tied with a face-to-face visit to a doctor, for example, is I think a very beneficial, especially during this time where we want to reduce the exposure of everybody from COVID-19.
But how do you describe the demand, sir? How was it?
The demand certainly has ramped up tremendously over the past year. We've seen a jump of about 170% in terms of demand. So it's been massive, and certainly that speaks well to the fact that people are more accepting, more willing to try. Now, certainly, if you have a fear of contracting COVID or any other disease for that matter by going to the ER or going to the clinic while you're waiting there in line for an hour, for example, that you would be willing to try something else. So I guess I'm not surprised that was the response of our customers.
Thank you. Anyone else would like to add to that, Mr. Tan?
Yeah, with us, teleradiology has been around for a while, and we, have sold sophisticated CT scanners to all corners of Mindanao, for example, or to Basco, Batanes, and the images have been read by radiologists based in Davao or in Cagayan, and so they are able to do teleradiology and diagnosis remotely. Another factor, very important, which we see is the patient data communication archiving. And a lot have already gone into this. Of course, the huge saving is on X-ray film, and that's the environmental benefit. Then you have the space requirement, no, where you put them into hard disks and you can archive them more efficiently. And we see the trend even at Department of Health, where all their future moves are all digital based. And this shows that we're going in the right direction as far as digitization in healthcare. Yeah.
All right. Thank you, Mr. Tan. From Mr. Tayag, sir. So, from the DOH perspective, how is
Okay,
it?
RJ, thank you so much. Our digital health interventions has widespread applications because we have interventions for clients, that's the patients, and even healthy individuals, healthy Filipinos that we have to serve so that they have adequate access to health information and services. The intervention also, and an example of that is telemedicine. We have actually collaborated with Medgate last year so that we can introduce telemedicine to many Filipinos that require them or need them. Then we have interventions for healthcare providers, just like the electronic medical records, which we were able to establish from for primary care facilities and even hospitals, primarily in the public health sector, and that was since 2012. And we have also interventions for health systems, like our contra COVID chatbot, so that we will be able to provide information. Then we have interventions for data services, wherein we have a unified enterprise architecture. Several agencies and even the private sector were able to harmonize this system so that they remain interoperable while maintaining the cybersecurity features that will protect the data privacy of many Filipinos when they use these digital health tools. Thank you, RJ.
Dr. Tayag, it's interesting to hear that public hospitals, the DOH, are making use of telemedicine. But how do you assess so far the application of this technology?
Okay, in March, when we it was announced that we had an enhanced community quarantine, we had to immediately step up our response to the pandemic so that we had a COVID hotline 1555 thanks to Smart PLDT and the DILG. And then slowly we introduced telemedicine because there was a demand for it. This was audio calls, not your high-end virtual telemedicine. And slowly we were able to actually roll this out, scale it up, and had collaborations with third-party providers for telemedicine. We have monitored the demand. It has been increasing, and we monitored also for complaints. Everybody is a happy clients with our 1555, and also with our partners. And but we have not, RJ, uh, have that uh, optimal consumption of these services because there are challenges like the infrastructure and connectivity, the culture that we have to change because there may be Filipinos that are not just comfortable with the technology, and we are addressing that. And some rules because this may have, for example, legal, ethical complications. And we have worked with the UP National Telehealth Center so that we can provide guidelines. And we like to thank the Department of Information Communications Technology because we're working with them closely so that the infrastructure and connectivity will be a thing of the past. Thank you, RJ.
All right, Dr. Tayag, you mentioned culture as a hindrance to embracing telemedicine. What do you mean exactly by that?
For example, when a Filipino want to access health services, there's still bias for face-to-face, but the restrictions for face-to-face are so obvious that this has been disrupted, the access to quality health services. So their options was to take care of themselves, get advice from other people, make use of social media. There's the World Wide Web, but of course they will be at risk for making wrong choices or wrong decisions, so they have to reach out to a professional. So telemedicine provides them with this platform. But of course, those who are not familiar with the technology will find it strange that they're talking to a doctor not familiar to them, but they become comfortable, and of course, the continuity of the services may not be that will provide them an excellent patient experience. And another culture is the intergenerational gap. So there will be the young adults that can actually be more focused on social media conversations rather than telemedicine. So they make their choices outside the telemedicine universe, but we have patients with chronic conditions that have no choice but to consider telemedicine. So another cultural thing is that it ranges from something that you need to have confidence in using the technology, and that culture wherein uh, it speaks of trust, confidence, and making sure that your privacy is not violated. Thank you, RJ.
Thank you, Dr. Tayag. And now, for tech companies, are there new technologies emerging as a response to the ongoing public health crisis? What human services do they replace? Mr. Tan?
Yeah. And the technologies are there. Like we do have set up at the lung center, which was AI powered for detecting lung abnormalities. No? This was running well. It's still being used now. But it's not the magic bullet that says you have COVID or not. No? That's a mixture of many tests, no? And doctors' analysis. The efficiency has been supported. Many, like in private hospitals, many of the radiologists do not go to the hospital. They will diagnose remotely. And this was during ECQ, no, where lockdowns were really tough. And but still, the service went on, no. In our case, we can diagnose our machines remotely as well if they're connected through the internet. No, and we can tell ahead of time if something will go wrong with a machine, a CT, an MR, no, or an X-ray machine, to speed up the process and avoid unnecessary contacts. However, of course, our engineers are frontliners here, and physical replacement of spare parts is needed, and that's why they go in fully protected. No, but so AI, you have digital archiving, communications, and it's very interesting on the telemedicine and telehealth topics, which Dr. Tayag and Ron mentioned. because I think this is something of the future. You know. Yep.
Mr. Tan, is there a challenge when it comes to making sure that diagnoses are accurate because you're doing this remotely? How do you do
Oh,
that?
on the technical, yes. I mean, on the technical side, it's a machine, no,
Yeah,
and software. On the medical diagnosis side, whatever the radiologist would see inside the hospital on his monitor, he can see at home or wherever he is located. No, this is not new. No, this is something that has been around and being done for many years, but it was stressed even more. No, the need to use it even more came up with COVID.
thank you. Mr. Australia,
Yeah,
you have
I,
something to
I
add?
I wanted to weigh in a little bit, and it's interesting the question you asked about whether technology replaces, certain jobs or certain people or certain
Yeah,
existing institutions. I want to say that in our view, we find that telemedicine and the existing infrastructure and doctors, so basically doctors and medical facilities that exist currently, we believe that it's a complementary or a synergistic relationship, not a replacement. In some of our cohorts of our own customers, we're seeing telecare rates of up to as high as 70 to 80%, which basically means 70 to 80% of our callers are don't ever have to see a face-to-face doctor because their condition is treatable by telemedicine remotely without the need for physical intervention. So when you have a stat or a telecare rate that high, and we can do that, how are we able to do that? Well, and that's of course that's our proprietary clinical guidelines in effect, and all of the experience that, as we said, we've been doing this for over 21 years now, with over 11 million teleconsults delivered globally. So statistically based guidelines have been created, so we can then be able to diagnose accurately. Up to, you said, 70 to 80%, and so it's an interesting one because I see it from a synergistic perspective, because that would mean that those 70 to 80% of patients who came to us won't now clog up let's say the DOH medical facilities, for example, or Makati Med or St. Luke's or any of the tertiary hospitals, right? So basically it will allow the actual physical medical facilities and doctors to actually deal with the conditions that they really have to deal with. I mean, there's no reason why the surgeon in the ER has to deal with somebody who has a fever and hasn't even bothered to take paracetamol yet, right? So I mean, just as an example. So imagine if you could get those kinds of patients who certainly have a condition and definitely don't want them to self-diagnose. They really should see a doctor if they have a fever, but they can do that telemedically instead of actually going to the facility and get in line with all of the people. So I mean, imagine if you just had a tooth infection that caused the fever, but because you got in line, you got exposed to COVID, for example, and then now you're COVID positive, right? So I mean, it's that kind of thing that we're hoping to avoid and prevent, and be able to now free up the doctors under the DOH, for example, to be able to treat what needs to be physically treated.
okay. Thank you for mentioning that synergy.
Yeah,
But
but
all right.
one more comment. One example was me. I have a medical condition and I have to see my cardiologist every year. No, and this year, what I did was I downloaded all my data from my Apple Watch and my other instruments and records, and I just sent them by email to my cardiologist. And we had a phone consult. Well, good thing everything was okay. And we had a phone consult for 5 minutes, and that was that. Sure, I went to have my blood work done in the hospital, but that's all. See, so even personally, I have experienced this already. And it works. Yeah.
Yes,
Thank
it's
you.
working. It's working already, definitely. But I'd like to hear from you how this exactly is helping communities in far-flung areas. Do you have experience helping them or reaching out to them? Offering technologies like this for their medical needs.
I can only see what we are doing right now, where I think we have projects at Department of Health uh, together. I think with the World Bank and Asian Development Bank, and we are delivering over 200 mobile X-ray machines to remote areas, and these are all digital, and they are set up, including their Wi-Fi connections, so that we can remotely send them, and in most areas with their own PACS workstations for diagnosis. See, so this one I'm very hopeful when it's done. We'll be able to provide digital solutions not only to the regional hospitals, but even down to district level. It takes a lot of money, takes a lot of work, but it can be done. This is just one ongoing example which DOH has driven and is driving very hard. Yeah.
Yes. Dr. Tayak, do you have anything to add to that?
Okay, thank you, RJ. That's a main concern for the Department of Health because while these digital health interventions or tools or applications or IT solutions complement the health services that are provided in this pandemic, it can also be something that we can worry about, especially if we lose equity. What I mean is that imagine if only those who have access to their gadgets, to these tools, and we leave behind many Filipinos that do not have access to these tools or they don't have connectivity, there's no infrastructure in these areas. And so while we may have introduced these tools, then there will be population that will be lagging behind, they're left behind. And so we're very careful when proposals sent to the Department of Health. We make assessments so that we don't widen the gap for these equity issues. We want to make sure that it narrows the gap, that those who deserve for improving their the health decision making, their choices, that it actually will benefit the poor Filipinos rather than the other way around. Thank you, RJ.
Thank you, Dr. Tayag. Yeah, Dr. Tayag actually mentioned not widening the gap. I wonder, from the perspective of tech companies like Mr. Australia's, how do you take that?
Yeah, I absolutely agree with Dr. Tayag. And it is why, and Dr. Tayag alluded to it when we did the COVID hotline, the helpline, sorry. There were phones. And the thinking here is that even a feature phone, so just a basic Nokia, whatever, 3210, for example, in the old days, even a basic phone that's not digital, although cell phones are digital already now. But having said that, it's just a simple phone call. And that's what's interesting about Medgate, because we were founded during a time that broadband internet didn't exist. It was 1998. So I think state of the art was, in fact, the Nokia 3210 at the time. So you could only text or call. You couldn't surf. You couldn't do any of these things. Apps were very limited. So and it's something that we at Medgate, it's very basic, it's very core to how we've rolled out our platform, is that a recognition that you need to be able to deliver services by just a regular phone. And that's something that we're very proud of. And again, to be able to do that, you need the big data that we have to be able to aid in the accurate diagnoses by purely audio means.
All right, thank you, Mr. Australia. Dr. Tayag also mentioned already culture as a barrier to embracing, health technologies. Mr. Tan, can you mention some more challenges that you that your company actually faces today when it comes to convincing people, convincing firms or partners to, partner with us, work with us, embrace technology? Aside from culture, what do you think are existing challenges?
Um, okay, yeah. Culture in our field is not uh, too relevant. I can only think of one case for breast imaging, no, where we encourage early detection of breast cancer, and there are some groups who are not comfortable with this, no, and that causes breast cancer is the number one cause of cancer in the Philippines for women, and and there is a very high um, level of knowledge about this. But in some areas, there are cultural roadblocks. No, that's the only one for culture. Okay, I don't think I'm in a position to talk about the vaccine questions. I think Dr. Tai is more knowledgeable about that. But aside from that, technology, as far as imaging is concerned, I think it's very well accepted. It's getting the service to the patient is delivery. It's transforming care delivery, and we call it precision medicine. No, and to deliver that to the patient, that is the challenge that we are working on. They Before, a CT scan used to be some special examination. I'll tell you right now, a CT is as routine as a chest X-ray, and they use it so often for so many things uh, that it's actually every hospital should have one already. No, and they financially it's also a challenge for customers, but they see there are good returns, no, on the financial side, so that can justify the purchase of such a machine. There, the cost has gone down considerably, so it's more accessible. Um, and as I said earlier, we have CT in remote places. No, I'm talking a lot about CT because this whole year has been COVID related. A lot of technology purchased was mainly for COVID. Markets for less important things like MR has very magnetic resonance has very little COVID related applications, but CT had, and it was a big year for CT. No, and X-ray, of course, is standard, and sometimes ultrasound. So again, the I think as long as technology is there, the Filipino will go or is attracted to the newest, greatest, latest. And when a new hospital would open and market such services, they come in. No, and the Filipino culture, they will sell the Carabao just to get the best service for themselves or for their relatives. And this we see a lot still.
Mr. Tan, you mentioned financial challenge. What do you mean exactly by that? Are
Well,
hospitals actually increasing their budgets for such technologies?
well, the owners invest. No,
Yeah.
they when you see a CT, let's say whatever, let's say it costs 20 million, and they
Mm.
would say, "Wow, they never think of that." Well, but then when they look at the numbers, they look at their patients, they look how many patients they send out for a CT, so how much business is lost, and moving the patient also has its uh, negative effects, and they can do it in their own hospital. They will invest. No, see, so these are the privates, no? The private small hospitals, and we saw a lot of the bigger institutions in Manila, in NCR, and the major cities have more or less held on to their budgets because they had to spend for COVID-related things, no? PPEs, tests, all these, everything related to COVID. But I'll tell you, the hospitals out in the province continue to invest and to build new hospitals. No? Smaller ones, community hospitals, and this is something we noticed even through COVID. It went ahead. No?
Mhm.
Yeah.
All right, Mr. Australia, you have something to add.
Well, I mean, it's really a situation where I mean, from a cultural perspective, again, back to the issue of culture, it's interesting. And Dr. Tayag again, raised it, the generational issue. Certainly, we believe Gen Y and Gen Z, to that extent, are more likely to use technology applications, health applications. So, and in fact, that's what we are. I mean, we have a large base of customers that are from the BPO field, right? So you would think that you would expect that they would be more willing to try telemedicine because it's some technology, something they're really exposed to from their generation, and it's fine. It's true. We are seeing that. There's a large percentage of our customers who are actually below 30 years old, for example. So we're seeing high usage from that generation.
Okay, thank you, Mr. Australia. Now we have a question from the audience, and the first one here is: how can we make quality and high-tech healthcare services more affordable to many Filipinos? Who would like to take this? Again, how can we make quality and high-tech healthcare services more affordable to many Filipinos?
Okay, RJ will take that.
Yes, Dr. Kayak.
Yeah, for many years we have actually tried to address that, and the Universal Health Care Act has now given us the impetus so that every Filipino will be able to access the health services they need, that these are affordable, that they will not in any way suffer from financial hardship. We are implementing the Universal Healthcare Act with many components, including digital health interventions. There will be We anticipate that there will be huge investments upfront, but in the long run, this will provide cheaper alternatives. But this is not something that will happen all at once. We expect that the changes will be 2, 3, or even 5 years from now. And we just hope that everyone is patient about the changes. It's not going to be obvious, but slowly, as we get out of this pandemic, we are going to see health services being delivered in a different way so that many Filipinos will be protected against financial hardship. So, affordability is a relative term. Uh, it just means that the quality of these health goods and services do not necessarily have to be cheap. If they're expensive, but these are affordable, and government or our private sector partners can deliver them, especially with Medgate and Siemens, why not? Thank you, RJ.
All right, thank you, Doctor. And anyone else?
Yeah,
Mr. Mike? Yeah.
I'd like to comment also. I agree totally with Dr. Tayag. For example, radiation therapy. When you get hit with the news that you have cancer, wow, your whole world collapses, no? And we for years now, probably not many people know, but radiation therapy is covered by PhilHealth. And the government also has invested a lot of money in putting up radiation therapy facilities in the regional hospitals. No? And but you're talking of a cost of it's 30 courses, what, 800,000-900,000 pesos, and that's covered by PhilHealth. No, so whether you are if you need the treatment, no, you can get it and covered on no billing arrangements. No? Yep.
Thanks, Mr. Tan. Mr. Australia?
Yes, RJ, I just wanted to say that technology inherently is a force multiplier. And as a result, inevitably, costs end up coming down down the road. As again, I agree completely with Dr. Tayag. We have to be patient because as we roll these new technologies out, and technologies have a tendency to do this, there is a large upfront investment in a platform, for example, or a piece of technology. But then it's a question of driving as many patients through that technology. That's when you start getting costs per head to be much lower versus how it was done before, for example, right? So it's a situation where once you've established the infrastructure, again, whether it's a bridge, whether it's the skyway, whether it's once you drive people through that channel and actually make use of it, then that's when you start enjoying these cost savings per head.
All right. One last question from the audience. If not for the pandemic, do you think Filipinos are ready for telehealth?
Can I take that first?
Sure.
Yeah. So clearly, I mean, we've been at this for over 5 years in the Philippines, and I've already said earlier, right? I mean, we've got over 1.5 million members right now. So these are through employee benefit plans. So basically, it's their employers who have seen the value of it and have then enrolled their employees through it. And we're seeing great usage. And as I said, there was this huge jump, 170% jump in call volume during the pandemic. And that's, to me, testament to the fact that people are, in fact, ready. Now, will they be even more ready a year from now? Yes. And as you go along, as technology becomes ubiquitous for everybody, and telemedicine here, telemedicine there, city scans, digital city scans that are online, are talked about, and the ability to do online surgery, for example, when you've got an expert at Johns Hopkins teaching a doctor in Makati Med how to perform a specific surgery live on the spot, for example, that kind of technology, I think people will be surprised that it's already there. And again, it's I think incumbent upon us in the technology field, and of course people like Dr. Tayag, who implement for public strategy, public administration, that you make the impact on the end user as light as possible. For them, it's like, well, it's just like something that we're used to. But lo and behold, there's actually a huge technological back office that supports it all. I think that's how you want to do it. You want to do it so that people aren't changing necessarily how they do things. It's just what they're doing is supported with technology. So in the case of Medcaid, we've taken the view that, look, everybody, whether you're in the province, whether you're in the NCR, whether you're on an island somewhere, you know how to make a call. You know how to call. If you're an OFW, you're calling back to the Philippines. But every Filipino knows how to make use of a cell phone to call a phone number. So we're not changing, behavior in that sense. We're simply saying, look, I mean, instead of calling a hospital to make an appointment to go see a doctor, why don't you call the virtual hospital and talk to a doctor already immediately? So that's the kind of thing that we're trying to do, and what technology does. It makes it a little bit more faster, I guess, real time, and be able to deliver high quality service, more controlled, backed up by data, for example, that everybody can enjoy.
Okay.
RJ, can I share my thoughts on this too?
Sure, doctor.
Okay, there was a silver lining in this pandemic response wherein we were able to actually roll out telemedicine, as what Mr. Ron Australia has been sharing us in this webinar. But we are not just seeing the tipping point, because we were expecting that this should be the tipping point for telemedicine and other digital interventions that are currently in use. We don't have the numbers, but we suspect that these are early adopters, and just like the tipping point, we hope to reach the majority slope in a few months, or this may take a few years. We don't know. So this is now an opportune time for the public and the private sector to join hands. And with the technology provided to us from Medgate and even Siemens, then we can actually reach out to many Filipinos, forget about the cultural barriers, and so that we can move forward and from the nascent stage of these digital health interventions, we will be looking at technology as our partner for delivering the quality health services we all deserve. Thank you.
Thank
RJ.
you, Dr. Tayak. That actually answers the last question. That with the cultural and infrastructure barriers, how will telehealth move forward in a post-pandemic era? I don't know if Mr. Mike Tan has something to say
Well,
to that.
telehealth for me, honestly, I believe the future is home care. I mean, we should be able to be diagnosed remotely. We should be able to consult remotely. A lot who have been working from home the past year have appreciated this. No, we incidentally tomorrow we are launching a robotic system in a webinar, which uses robotics to do cardiac interventions. No, into as well as I think in the future it will also be neuro. But these robots can be controlled even by a doctor from another hospital, as Ron mentioned earlier. No, a somebody from United States can actually do the procedure in Manila, no, using the robots like you are flying through your process, no, to clear your arteries. So so remote care, remote treatment, this is the future. We're there actually. No, the technology is there, and it's again, it can take as Dr. Taig mentioned, can take months, it can take years, but eventually the rollout will happen, and it will be the way to go for the future. Yeah.
All right. Thank you very much, Mr. Tan. Now, before we end this discussion, we would like to hear each gentleman's closing statement. And I think we can start with Mr. Tan, to be followed by Mr. Australia, then Mr. Taya, Dr. Taya.
Yeah. Thank you again. Again, statement is really digitalization is the way forward for healthcare. We have to make things more efficient, faster, more accessible. No, we have to provide a level of care of what we call precision medicine, transforming how we deliver this, making the patient experience better. No? And this can only happen through digitalization. COVID has sped things up. AI has shown its face now, and AI has much more to offer to assist our doctors, our healthcare professionals, to make the right diagnosis. and this is the way forward. And we, as Siemens Healthineers, are fully behind this, and this is our mission for the years to come.
Thank you, Mr. Tan. Mr. Australia?
Okay, thank you, RJ. So again, just like what Mike said, telemedicine and telehealth is here to stay. It is, the way to say it is the new normal, and we're part certainly of a fast-growing industry in the Philippines, and we believe that the key drivers for the growth of telehealth and telemedicine, I think, hinges on a few on three things in my mind. One, of course, we can't lose track of the fact that we need more doctors. I think that's front and center. We need more doctors, more frontliners to be able to provide healthcare, first of all. And so once we have more doctors, then we can leverage the platforms and the technology that we have. Now, to be able to do that, to leverage that technology, you require affordable, high-quality internet bandwidth. So, with the rollout of the pending rollouts of 5G, I think we'll be in better shape, I believe. So that's an infrastructure, and other, I mean, that's key on my mind, but certainly there are other infrastructure projects that need to be launched as well to continue to grow telemedicine and telehealth. And of course, what I led with, which was advances in AI as the next frontier. And again, it's not looking to replace jobs or replace health workers. It's to allow AI to do the job of the mundane, of the basic and straightforward, to allow our personnel to be able to handle the more complex, the more complicated. And I think that's where AI is going to be a great force. So I just wanted to end with the fact that, I am confident that with all the efforts of everybody in this panel, Dr. Tayag and Mr. Mike Tan, I am confident that we will achieve our vision of providing easy, convenient access to healthcare for all Filipinos. Thank you and good day.
Thank you, Mr. Australia. Now, Dr. Tayag.
Okay. A transformation is happening in the health sector, where choices are made by health providers for their patients. These digital health interventions restores the balance so that choices from patients themselves are in equal footing with the choices the health providers would provide the patients. And for all of us, these digital health interventions is happening now. It's not even the future. And if you observe around, your participation in any of these digital health interventions makes us confident, and we trust you as you trust us, that this is the way we have to provide the health services that you urgently need. Indeed, the Department of Health, together with their partners, especially those that have provided these services ahead of those, we encourage you to participate. It's all up to us. Good morning. Thank you, RJ. Thank you, Mr. Ron. And thank you, Mr. Mike. Maraming
Thank you.
salamat.
Thank you, gentlemen, for giving us your time and lending us your expertise. Thank you also to our sponsors, PLDT Enterprise, Siemens Healthineers Philippines, to our partner organizations, British Chamber of Commerce and Industry, Management Association of the Philippines, Philippine Chamber of Commerce and Industry, and Pharmaceutical and Healthcare Association of the Philippines, and our media partner, the Philippine Star. And of course, to everyone who joined today's discussion, thank you very much. And join us again tomorrow at 11 a.m. to learn more about managing fraud amid crisis. Follow Business World's social media pages to be updated for our next projects. Again, this is RJ Baninbin, and this has been the Business World Insights. Stay safe and stay healthy. Good afternoon.